Hi, I'm Jodi Johnson, Inpatient Nurse Manager at Cherokee Regional Medical Center, a critical access hospital in Cherokee, Iowa. We're here to spotlight two of our nurse residents from the Iowa Nurse Residency program that have graduated and done successful things at our facility.
Hi, my name is Amanda, and I'm an RN up on MedSearch 4 here at Cherokee Regional. I've been an RN for about 3 years now, and I graduated from the Nurse Residency program last September.
Hi, I'm Kaysie Vauble, and I'm an RN on the medical surgical floor at Cherokee Regional Medical Center. I've been a nurse for 3 years, and I graduated from the Nurse Residency program in 2018.
Kaysie and Amanda, can you please tell us about your initial thoughts on the Nurse Residency program, specifically the project piece as well?
Initially, I was hesitant as I had been a nurse for about a year. I had been in the BSN program for nursing, and I had already completed a project.
I thought initially with the program it would be overwhelming just because I was a new graduate from nursing school, and I was getting my feet wet just being a RN and training on the floor. So I thought it would be a little overwhelming to start this residency program and project.
When we talk about your projects, what did you guys find as the biggest challenge or barrier?
My project was on pain management and implementing the comfort scale instead of the 0 to 10 pain rating scale. My biggest challenge was implementing this on the floor and having nurses switch from using the 0 to 10 rate your pain to the comfort scale and having the patient describe it better.
I did a project to boost our HCAHPS, our Press Ganey scores, just to increase patient satisfaction. So I focused on how to make our environment calmer and quieter for the patient to be able to rest without interruption and to heal faster from it. My biggest challenge was gaining information from my peers and from my patients if they were satisfied with my new policy and protocol that I established.
Now that it's been a couple years since you implemented your projects and had time to reevaluate, has your perception of the University of Iowa program changed?
After a couple years since being in the residency program, I would say my perception has changed. I found it was very helpful. It's helped me to use critical thinking. I look more at the unit and determine things that could improve. And then we talk about this more. We have formed a unit council, which Kaysie is our president, so she can tell you a little bit more about that. You talk?
So it's been a couple years since I completed the nurse residency program. My project has been a huge impact on our hospital. Satisfaction scores have increased with the patient's environment since we started the quiet time project or policy. I feel like looking back now that it was a good experience. I was able to understand the dynamics of the hospital and patient satisfaction and how to help my hospital become better.
You both are very active members on our unit. How do you feel that the residency program comparison to now has built you into a bedside leader?
At first, I thought as a nurse that I would just be taking care of patients. I didn't think that I would be involved in the quality and evidence-based part of nursing. But since the nurse residency program and completing the project, I found myself focusing more on things that we can do to improve the patient's experience, not just their health-wise, but whether it be their food, what we can do to make them more comfortable, anything we can do to make their experience better. And us two, we are both part of the unit council, which has been good for our leadership, and we both participated in a leadership course as well, helping us to become better preceptors on our unit as well, which has been a great experience for both of us, I think.
Like Amanda said, I never imagined myself doing anything other than taking care of patients on the floor. I never thought I would be involved with more of the administration aspect of the hospital and patient satisfaction. Like Amanda said, we did do a leadership program, so now we're more involved with orientation of new nurses, preceptoring new students, or nursing students, I should say, and we're also every day we're looking forward to making changes here with our unit council. That's what we really focus on, is not just patient health, but patient well-being and overall happiness of the patient. So with unit council, that's really helped implement more policies and procedures.
As a leader, I really want to thank the online Iowa Nurse Residency Program for building these bedside nurse leaders. We are very proud of them at our facility and the successes they have helped implement from the bedside again.
After going through both of the programs, I would highly recommend this to new nurses, experienced nurses. The nurse residency program itself helped me gain skills in communication with my peers, patients, physicians. I believe I am better at critical thinking when it comes to taking care of my patients. And the leadership course that we took really helped me to learn how I can better teach oncoming nurses, as everyone learns differently. So that was a great experience as well.
I have to agree with Amanda. The programs really helped boost our abilities to communicate, not only with our physicians, but with our peers. As new nurses, that's one of the big hurdles that we have to overcome, is communication among our healthcare team. So that really helped quite a bit. That would pertain to new nurses, seasoned nurses, or anyone who would want to help boost their confidence in speaking to their healthcare team and peers. With the leadership program, that really helped us reflect on our new beginnings of being a nurse, adapting to them, being patient to new orientees or students, and just helping them be a good nurse someday. So I definitely really like both of these programs.